Hello, class. Good afternoon. Hello. Okay. So I already um, is it already visible on your screen? The ones that I okay. Okay, we're done with our learning module number 3, which is the components of healthcare system. And now we're going to discuss our learning module number 4, which is entitled Health Sectors Governing the Healthcare System. Okay, health sectors, these are, it could be a company or a facility that is owned by the government or could be owned by a person, privately. Okay, it's not only the hospital that we are um, that are considered to be the sectors or that can govern our healthcare system, but also those pharmaceuticals, no, the drugs that are selling or drugs are manufacturing the medications that are needed by the patient, because healthcare system or healthcare cannot be rendered by the hospital without these following companies who can also add on to their help, no, not only the company who manufactures medications, but also those equipments or advanced equipments, no, or technologies that are very helpful tool in some procedures that being done in the hospital, such as surgery. So daghan kayo mga sectors nga govern sa atong healthcare system in the Philippines, no? And they are just one of, and the ones that I just mentioned are kato sila, no? And then later on, we are going to classify them because it's really broad para mas masabtan nato. Learning outcomes at the end of this lesson, student must be able to demonstrate competence in understanding the role of health sectors in the healthcare system. And number 2, critically assess the functions and services offered by the different sectors. Okay, you have learning introduction here. The healthcare industry provides a variety of services to support the healthcare needs of the community or individuals, specifically the patient, no? A patient or patients. The healthcare industry classifies the different products it offers by sector. Hospitals and healthcare systems are continually changing their service offerings and responding to various internal and external forces, including reimbursement issues, advances in technology, and shifts in the population and they serve. A universally agreed upon classification of sectors does not exist, so a non-exhaustive but inclusive and simplified classification of broad sectors will be used in this exploration. Okay, the following are the key sectors of healthcare industry that can be broadly classified in the following 4 sub-segments. Number 1, these are healthcare services and facilities. The healthcare services and facilities could either be a government-owned hospital, which is definitely funded by government as the people, no? And we also have a hospital that is privately owned. And this hospital that is privately owned is funded, of course, by a private citizen, no? So later on, guys, we're going to differentiate no between the two amongst the two kung unsay kalahian nila. what services that they can offer to the patients, and what is more okay, no, or okay nga hospital ang nga pwede nato adtuan, ang gobyerno ba o ang private. Kinsa man nga hospital pod ang ang dali tay pasulod o dili, no, kay each hospital has its own rule. But definitely guys, if you're going to a government hospital, since it's free, they cannot actually refuse you to get in, no, or to be admitted. They really have to attend to your needs. Why? Because we own the hospital, and that is owned by the government, no, us the Filipino people. Sa private hospital pod, whatever services that we would like to have, and whatever services nga pwede nila offer sa tuwa, and if it's very needed, then they really have to attend to also, to attend to that services also, no. Ang importante nga makabayad ta, kay kung di ta makabayad sa hospital sa private, then that's the time that they will going to stop the service that they would like to have. Tama, no? So daghay kalainan po na siya. And then number 2, we have the medical devices, equipment, and hospital supplies and manufacturers. Okay? The quality healthcare services that our medical professionals would like to render, no? Okay, to render needs devices, equipment that is a very important or helpful tool, and some of the procedures na ginabuhat sa clinic or hospitals. It could either be private or government. Number 3, okay, to stop the stress of the family of the patient, no, and the patient itself, no, sila mga bayro nun sa hospital, it's a very helpful tool po ang mga HMOs, the Health Maintenance Organization, no, such as the medical insurance, medical services, and managed care, because they don't have to pay for the bill, because the HMOs will be the one to pay for whatever bill that they will incur sa pasyente, no. Number 4, we also have the medications, the drugs. Okay, it's very important nga for a patient's full recovery, no, na naa sila ginatake na medications or drugs that is being prescribed by who? The doctors, no, sa hospital. So these are important sectors of healthcare industry. Okay, the healthcare sector consists of businesses that provide medical services, manufacture medical equipment or medications or drugs, provide medical insurance, or otherwise facilitate the provision of healthcare to patients. To patients. Okay. Okay. Belisario, can you please read the definition of healthcare delivery system by Williams Tongpalan of 1981?
Okay, sir. So, it is the network of health facilities and personnel which carries out the task of rendering health care to the people.
Okay, that's healthcare delivery system by Williams Tongpalan. Continue, please, Nathaniel. The Philippine healthcare system.
So, the Philippine healthcare system is a complex set of organizations interacting to provide an array of health services according to Dizon, 1977, referred to PPT Healthcare Delivery System in the Philippines.
Okay, thank you so much. Okay, guys, remember the medical professionals cannot deliver quality healthcare service without the three components of healthcare, no? And these three components of healthcare make up the healthcare system in the Philippines. Okay, so just to make it sure, no, just to complete it, the definition of Philippine healthcare system, it is a complex set of organization interacting to provide an array of health services in the Philippines, no? Because each country has its own healthcare system, no? So nila pagpadagan sa ilang healthcare system. So that's it, no? Canada, US, tanan-tanan. Bisan asa na nga country, they have their own array of healthcare services. Okay? And if you notice guys no ang atong healthcare system dire, I'm not humiliating the Philippines but it is really really true. It's a fact that the Philippine healthcare system is not as good as or as not as quality as the healthcare services that we have in Canada, or it could be in US, or it could be in Australia. No, it could be the same as India, or it could be the same as Cambodia, but not as no as better as Singapore or any other countries who have really more access to healthcare services. No, because why? Because of the funds. Maybe number one, the funds, the budget of the government, no, for the year cannot really accommodate the population of the Philippines. No, there's a lot of us na kinahanglan siya og healthcare services, no? And then yeah, the budget itself is dili gid siya nakatsada, no? And then the equipments that we have in the hospital is not as advanced as compared to other countries. We may have a lot of equipments, advanced technology, no? State of the arts and facilities, pero dili sa government, sa privately owned hospital. But the consequences really have to pay for them, no? We pay a lot compared to government, which is actually free. No, that's actually a big difference no it comes to healthcare system sa tuwa ug sa laing nasod. Okay, okay, now we have healthcare services, government versus private sectors. Gagarin, can you please read, Daryl? Okay, here guys we're going to differentiate now. We would like to find out what's the difference between the government hospital and the private hospital, or the government facility or the private sector facility. No, government funded by the government, funded by, it could be funded by a private citizen or a businessman, no? But guys, remember that the hospital that is being owned by the government could be funded also by NGOs, no? These are the non-government organization, NGOs, no? These NGOs actually as is very specific, no? They could partner with an agency which help those people with cleft palate, no? They could also help these people, mga mga indigent. So they're very specific, not only for one, no? Very specific. Okay. Okay, please read this one, Gagarin. Healthcare can be provided. Health,
Healthcare, ay okay sir. Can I be heard po sir?
ay, naka-open nga. Oh my, isa na. Ay, dyan ninyo. Adubusin, can you please turn off your mic?
Sorry, sir.
No problem, it's okay. Okay, go ahead, Daryl.
Healthcare service. Healthcare can be provided through public and private providers. Public healthcare is usually provided by the government through national healthcare systems.
That's
Private
that's national healthcare system, no, or the budget coming from the DOH, no, or yeah, from the national budget. Okay, continue, please.
Private healthcare can be provided through for-profit hospitals and self-employed practitioners.
Okay, stop.
And
Okay, Gagarin, can you please tell me? Can you please identify a hospital in CDO that is governed, that is owned by the government?
dili ko sure sir pero NMMC
Okay,
katong
that's
di
correct.
sa ano.
Northern Mindanao Medical Center is owned by the government, so it's a public hospital. So, so whenever um, you're having the experience of kabitong medical emergency, no? They really have to attend you. Kaso lang, ang problema lang, since ang atong resources sa hospital is dili ka ana ka kanindot no compared to private hospitals, because some of our nurses no na nasa laing nasod, gamay ra nurses, ang ratio sa nurse sa pasyente gamay ra, ay dili siya in ratio, no? Ang doktor sa pasyente 1:50. Inana lang kaya dili kay ta ma-attend sa mga government hospitals. If you agree to me, no, kay lisod kay kung moadto ka didto tapos emergency kayo, mamatay na lang ang pasyente, dili pa ma-attend. And it really happened to not only to some but a lot of people in CDO, no? Tinuod biya pud na, pero di yun nato mabaso lang ang atong gobyerno kay daghan kay to population. Dili gyud in ratio ang nurse sa pasyente o ang doktor sa pasyente. Mao nang the problem always exists, no, in some of the government hospital. I'm not saying sa NMC, pero daghan if you experience that one, if you would like to go and visit some hospitals that are governed, that is funded by the government, lisod gyud ang uban na apa sa gawas nakahigda, no, if you noticed it. Okay, ang private hospital gagarin, any private sector that you know that you can identify in CDO?
Polymedic, sir.
Yeah, that's correct. It's owned by Dr. Josephine. Nakalimot na yun ko. Yeah, Polymedic Hospital it's actually funded, or it's privately owned by the first name was Dr. Josephine, no? Okay? And then continue, please.
And not for profit non government providers, including faith based organizations. In a public hospital, the case may be entirely different.
Mm.
Government hospitals are funded by the government and therefore cannot turn away patients. On the other hand, the private hospitals are privately funded and make their own rules.
Okay.
Because of this,
Stausa. Okay. They have their own rules, guys, but once you're admitted, if it's emergency, kung naka sa private hospital, ilagi kang dawaton na because of we have the law, no? We have actually a law that applies to that one. Nga kinahanglan kanila dawaton, pero pag abot sa procedure, you really have to make a down payment sa mga private hospital in order for their service to be maintained, no, for their maintenance. Eh wala man, di man sila funded sa government, no? They just rely on the payments from coming from the patients. So we have to understand that one also, no? Continue, please.
Because of this, the private hospitals reject uninsured patients. Both sectors are very customer service oriented. The customer for the private company is one that has agreed to pay for their services, where the customer for the public sector is its citizen as it relates to public service. Private sector healthcare delivery in low and middle income countries is sometimes argued to be more efficient, accountable, and sustainable than public sector delivery. Conversely, the public sector is often regarded as providing more equitable and evidence based care.
Okay? So it's actually a long-term discussion and argument no nga so some doctors, some patients, some community people about their insights no about the private hospital that they give more quality service compared to the hospitals being funded by the government, no. Later on you have an activity that will that I will give you about sa private and government hospital, your insights, no? So let's move on to interdisciplinary approach to healthcare management. Okay? It talks about the team, the medical team. And this medical team should should relate to each other, no? They have this interdisciplinary approach in terms of medical procedures, no? Kay kung di sila magkasinabot, guys, if they will not work together as a team during procedure or during the code, then probably something will happen bad to the patient, no? And we have actually a lot of characteristics to mention later on, not to have an effective interdisciplinary amongst amongst the medical team. So who are the medical team, guys? The medical professionals. Okay, can you please state to me, no? Dukusin, who are the medical professionals? Can you please Give me an example. Example number one.
Nurses, sir.
That's correct. That's nurses. Okay.
Pharmacist.
Who else?
Doctor, sir.
Doctor. Okay, doctor is very broad. But if a doctor is specializing heart problems, cardiovascular diseases, and they are called what? Mas banyo? Doctor that are specializing in cardiovascular diseases. These are Tubal. What's your answer for that one? That's correct. Cardiologist, no? Anybody who's specializing a specific area or field of medicine, and that is mga specialista, no? And if it's specific, to be specific, like sa urology, they could be urologist, no? If it's if if they are specializing respiratory diseases and they are pulmonologist, sa doctor specializing kanang maternity and child, no? They are OB-GYN. So that's it. No, dag-og daghan pa. Napa-internist. Okay? Kinsa pa man ang mga medical professionals, guys? Anyone? Yugtan, Umpar? Yugtan? Can you please state an example of medical professional?
Medtech, sir.
Correct. That's medtech. Okay, correct. Anyone? Um, Gwyneth?
Nurses, sir.
Okay, nurses is already mentioned a while ago. We have medical technologists. We have the physical therapists. We also have respiratory therapists. We also have dentists. Okay, health aid or nursing aid, health assistants, and a lot more. Okay, they are medical professionals, and in some procedures, they are actually included in a team, in the team. No, Aso, can you please read interdisciplinary team factors? No, you start with interdisciplinary team factors.
Okay, sir. Interdisciplinary team factors are significant contributors to clinical performance and associated patient outcomes. Quality of care and patient safety initiatives identify human factors associated with team performance as a prime improvement area for clinical patient care. An interdisciplinary team is a group of healthcare providers from different fields who work together or toward the same goal to provide the best care or best outcome for a patient or group of patients. Some examples of specialties HAP can make up an interdisciplinary team include pharmacist, nurse. Beyond benefits to hospital staff, the advantages an interdisciplinary care plan provides to patients are significant. Increased collaboration among healthcare providers, especially between physicians and nurses, helps patients who have interdisciplinary care plans by reducing healthcare-related expenditures. 10 characteristics underpinning effective interdisciplinary teamwork were identified.
Okay.
Positive leadership.
Okay, number one, we have, okay, these are the 10 characteristics underpinning effective interdisciplinary teamwork. And we need this one, guys, no, pag nanata sa hospitals, not only in the hospital, but in 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 our respective medical facilities. No? Number one, what is that, Asok?
Ano sir, kanang positive leadership
And management attributes. Okay?
attributes.
Okay, communicate. Number two, communication strategies and structures. Okay, a doctor or someone in the team, no, each should be a good communicator, and someone in the group should be a good listener. Like for example, during the code, guys, no, if the doctor would ask the pharmacist to do an IV admixture of phenylephrine 1 milligram per ml, which is another special concentration from phenylephrine 10 milligram in a 100 ml D5W, then the pharmacist should prepare that one if he or she listens it properly, no? Makakahatag siya og tarong nga tambal o concentration. Number three, please.
Answer. Personal rewards, training, and development.
Okay, personal rewards. We have training and development. Someone who already underwent a training, no, or different kinds of training that would develop his or her skills. Okay, and then appropriate resources and procedures. Of course, that's very important. And appropriate skill mix, no? Different kinds of skills. It's not only it's not only doing that thing, but at the same time it's doing something that would also add on to the help of others, no? And then we have supportive team climate, which is a good um, team ambience, no? Individual characteristics that support interdisciplinary teamwork, who or he or she is dedicated, mura ginana, no? And clarity of vision. He has the goal, no? He envisioned that that after 2 hours, this patient will be revived, mura ginana ba? Then quality and outcomes of care and respecting and understanding roles, no? You as a medical practitioner in a team or medical professional in that in the group, no, in the team, no, you should know your job and responsibilities, no. If this is your job, you have to do your job, not others job, no, kay wala mga kabaluan to. So that's it, no. So please take note of the 10 characteristic underpinning 10 characteristic to have an effective interdisciplinary team work. Okay, so guys, I have here a learning activity, no. This activity was actually, you know, uh, created, kani siya nga module was created long time, no, during the pandemic. But I'm not going to let you do this, no, about the relationship report. Relationship report for each country ba, nga gatabang sa tuwa, gafan sa tuwa, in terms of health, no, in terms of of not only funding us, no, sa pagtabang sa some of the hospitals in the Philippines, but also some indigents or any sector, no, nga gapadagan og charity, no. So dili na nako na siya ihatag sa inyo, ha. This is what we are going to do. Okay, in an A4, it should be handwritten, no. Make an insights, no, insight. What's your insight about the government hospital or the the private hospital, no. But to summarize it, guys, mas better siguro magbutang tag, what can you say about the healthcare system in the Philippines? That's it, no. So ihatag ninyo yung insight sa healthcare system in the Philippines. What you can say, what's the status? Okay, am I being I do I have an experience about being humiliated in in a government funded hospital or a public hospital, or na-attend ba ko nila sa ako ang mga needs, or what can you say about it, no? Not only by yourself, guys, no, or sa imo ang nakitaan, sa imo ang na-experience sa mga tao nga nagsuli sa imo, okay? Or maybe you can research, you can do a research about this, no, the healthcare system in the Philippines, the status, is it good, is it bad, are we giving quality service, healthcare service to our community people or not? Okay, what are the factors why these are not being given, no, to individuals fairly, inana ba? So it should not be less than 100 words or more than 150 words. Now in an A4, submit that one 11 a.m. before 11 a.m. on Monday. Nakuha ba?
Yes, sir.
Okay. So that's it, guys. Now we should have two topics to. Okay. Okay, Bakoy. I want you to do to make an insights, no? What's your insights about the Philippine healthcare system? That's it. So the status of the Philippine healthcare system, Are they giving us quality service, no, in terms of healthcare? Or if you have any experience, were you given a good service? Nag-attend ba sila mo sa imuha diretso, or the things that you know about about it from other people, or research it about the Philippine healthcare system? Is it good? Is it bad? What are the factors that hinders our nurses or our doctors from giving us or providing us the quality service? Why is it that the healthcare system, which is funded by the government, especially government hospitals, is not as quality as the private sectors? That's it. No, Philippine healthcare system, or the healthcare system in the Philippines. Okay, not more than 150 words, not less than 100 words. Okay, in an A4, it should be handwritten. Okay, guys, see you next week for our farm ad and public health, no, healthcare subject, no, our healthcare lecture. Okay, we still have a lot of things to discuss. Siguro mga duha na lang ka topic, no, for the healthcare system. And then I hope you will be ready for the exam a week after next week. Okay, thank you for joining the class. If you don't have question, you can leave the class, and God bless. Bye bye.
Thank you, sir.
Thank
Thank
you.
you, sir.
Thank you, sir.
Thank you, sir.